I've been a doctor for over 20 years, and I can tell you the number one thing I tell every patient over 60 is, please, walk more. But here's what I don't always have time to explain in a 15-minute appointment. How you walk matters just as much as that you walk. And I've watched so many of my patients do everything right, 30 minutes a day, 5 days a week, and still end up in my office with aching knees, a tight lower back, no energy improvement. And they look at me and say, "Doctor, what am I doing wrong?" Today, I'm going to answer that question. 6 mistakes, 6 fixes, and every single one of them is something you can change on your very next walk. Now, before we get into the mistakes, I want you to understand why this matters so much more after 60. After 60, your cartilage, that's the cushioning inside your knees and hips, it's thinner than it was at 40, and it heals much more slowly. Your heart takes longer to adjust to changes in effort, so going from 0 to brisk walking is genuinely harder on your cardiovascular system than most people realise. And the small muscles that stabilise your ankles, hips, and core, after 60, they lose strength faster with inactivity than at any other point in your life. I'm not saying this to scare you. I'm saying this because you deserve to know what's happening in your body, so you can work with it, not against it. All right, mistake number one, and I see this constantly, skipping the warm-up. Now, I'm not talking about a yoga routine. I'm not talking about stretching on the floor for 20 minutes. I'm talking about 2 minutes of slow, intentional walking before you reach your normal pace. Here's what happens clinically when you skip it. Cold muscles are stiff muscles, and stiff muscles don't absorb impact. They transfer it directly into your knee joint, into your hip, into your lower back. After 60, those joints have less natural cushioning than they did 15 years ago. So that transferred impact, it adds up, every single walk. The fix is simple: walk out your door and spend the first 3 to 5 minutes walking slower than feels necessary. It will feel almost too easy. That's exactly how it should feel. You're warming up the engine before you push it. Mistake number 2, your head is down. I want you to picture this, because I promise you've seen it. Someone walking down the street, neck bent forward, shoulders rounded in, eyes on the phone, or just on the ground. As a physician, that posture concerns me. Your head weighs, depending on the person, 10 to 12 pounds at neutral. Tilt it forward just a few inches, and the effective load on your neck and upper spine can reach 40 pounds or more. 40 pounds on your neck for 30 minutes. Over time, that creates chronic tension, poor posture, and real pain that most people never connect back to their daily walk. The correction: keep your gaze 10 to 15 feet ahead, chin parallel to the ground, shoulders relaxed, back but not rigid. One simple shift, huge difference for your spine and your balance. Okay, mistake number 3. This one surprises people every time I bring it up. Your arms aren't moving. Walking is a full body movement. It was designed to be. When your arms swing naturally, in opposition to your legs, they reduce rotational stress on your lower back and help your whole body move more efficiently. But when your arms are pinned at your sides, shoved in your pockets, or holding a phone in front of you, your lower back has to compensate. And over 60, that's a compensation your back really cannot afford. The fix: let your arms swing freely, elbows slightly bent, hands loose. Not a power walk pump, just a natural relaxed swing. You'll feel it in your pace and in your lower back within a single walk. Mistake number 4, and as a physician, this is one I really want you to hear. You always walk on flat ground, same sidewalk, same smooth track, day after day. Now, your body is incredible at adapting, and that's actually the problem here. Once your body adapts to a flat, predictable surface, the stabilizing muscles in your ankles, hips, and core are barely being activated. Those are the exact muscles that protect your joints and prevent falls. Medically speaking, fall prevention is one of the most critical health priorities after 60. 1 in 3 adults over 65 experiences a fall each year, and weakened stabilizers are a major contributing factor. But you don't need a hiking trail. I'm not asking you to climb a mountain, a gentle hill, a patch of grass, an uneven path, a few times a week. That's enough to keep those muscles working and your balance sharp. All right, mistake number 5, and I have to be honest with you. This is the one I wish I had more time to discuss with every single patient. Your shoes are dead. Now, I know what you're thinking. But doctor, they still look fine. I hear that all the time. The soles look solid. The fabric is clean. They feel comfortable. But here's what the research actually shows. Walking shoe cushioning breaks down at roughly 300 to 500 miles of use. For someone walking 30 minutes a day, 5 days a week, that's less than a year. Once that cushioning is gone, every single foot strike sends impact directly up through your heel, into your knee, and into your hip. After 60, when your joints already have significantly less natural cushioning than they did at 40, this is not a small thing. Worn shoes are one of the most consistently underappreciated contributors to joint pain in my patients, and it's one of the easiest things to fix. So, when did you last replace your walking shoes? If you have to think about it, there's a real chance they're already past their useful life. New shoes, one of the highest return investments you can make in your own mobility. And mistake number 6, the one that happens right at the end of every walk. You finish, you're back at your door, you sit down, done. It feels completely natural. And that's exactly why it's such a problem. When you stop moving abruptly, your heart rate and blood pressure need a gradual ramp down, not a sudden cut-off. Blood can temporarily pool in your legs, which is why some of you feel dizzy or lightheaded right after finishing a walk. That's not normal. That's a sign your cool-down is missing. The fix: spend 3 to 5 minutes walking slowly at the end. Then, a quick stretch. Calves, hip flexors, hamstrings. That's it. Your heart recovers smoothly, and your next walk feels so much better than it otherwise would. As a physician, I will tell you this. Walking is one of the most powerful things you can do for your health after 60. It protects your heart, your joints, your brain, your independence. But only when you do it in a way your body can actually use. Warm up before you push. Keep your head up. Let your arms move. Vary your terrain. Check your shoes. Cool down properly. None of these are hard. None of them require a gym membership or a complete overhaul of your routine. They just require knowing what to look for. And now you do. Now I want to hear from you. Which of these 6 mistakes do you think you've been making without realizing it? Drop it in the comments below. I genuinely read them. And if this was helpful, hit that like button so more people over 60 can find it. Subscribe for more clear, evidence-based health guidance, built specifically for people who want to stay strong, mobile, and independent for as long as possible. I'll see you in the next one. Take care of yourself.